a drug is managed in the facility alone, you know that there's nothing you can do. Because almost everybody is interested in drug research. So, I know all of us must have learned a lot in our course of study what a control drug is, what made it a control drug, why it must be controlled. We all know that. Who do you expect to control it? It's us. The NDLEA people are not pharmacists, but they have been trained to track those kind of medications and ensure that laws guiding the use of those medications are enforced. That's the work of NDLEA. That's why you see a lot of times NDLEA staff challenging pharmacists. If you see an NDLEA staff challenging a pharmacist, it's because a pharmacist have left what he's supposed to do for another person. He has given you a case example of somebody who borrowed his license. Against the oath he has taken. Let us not forget, all of us are practicing on that oath. True or not true? We swore to protect life. But by carrying your license and giving another person, you have violated that. Because the person you gave that license, you have no idea how you will manage those drugs, what is going to use them for. You have no idea. So I want to believe that the control is still supposed to be in our hands. The laws are just there to support us. You understand? There is no law in the country that can tell you the quantity of control drug you can keep or you cannot keep. As he said, it's about what you need, not what you want. What you need. If you are operating a community pharmacy shop, you certainly have your control. Because your control drugs are dispensed under control. You have the person where you enter every use that you have dispensed. That should be able to guide you how much quantity of that control drug you will need over a certain period. If you are going to go and procure control drug in recent time because of the development of this national qualification guideline and the other laws, you cannot just go to the market and just buy control drug like that. As a pharmacist, I'm not saying as a non-pharmacist. As a non-pharmacist, you can go anywhere and buy. But as a pharmacist, you will be very cautious where you source your control. That is the reason why, if you want to source control drugs, there are procedures. Who are those practicing in this office? Is there anybody? No. Perhaps maybe some people are very intentional. Have you any experience how it sources its control drugs? Exactly. So there are some controlled drugs, and because they are so controlled, I think pentazocine is not one of them. You understand? Because pentazocine is still readily accessible in other places. Exactly. So those ones you have to follow some procedures, even get approvals, even from the Ministry of Health, before you send in your request or you go to the national level to buy a control drugs. So I want to believe it's us. These premises are existing because we registered them. If all pharmacists are to withdraw their licenses from all the practicing pharmacies in the country, those places will close. Do you agree with me on that? So it is on the backbone of our license that these controlled drugs are so uncontrolled. If you go to a pharmacy shop, you ask for pentazocine, in some places, you can easily buy it. Whether the pharmacist is there or not. As he said, in some places where you go looking for pharmacy, you don't even know. We went to a place for inspection and asked for the pharmacist. The proprietor is asking the sales boys, and what is the name of that boy? That's how bad it is. And that's because they don't attach any importance to you as a professional. All you require is that A4 size license. You give them a copy, they are done with it. That's because you have traded it for something. You will hang it there, you are away, or whatever happens, this noose is on your neck. So, pharmacist, when we say something is controlled, you have to use your professional training to make sure it is controlled. Meaning, if you are not in the premise, that item cannot be dispensed. It has to be under lock. I give you an instance because I saw that there are some case studies. There was a pharmacy we went to visit. One of our colleagues registered it. A military officer, maybe some of you have heard this case, procured, in fact, he procured pentazocine from that premise. Routinely, that's where he used to buy it. But he has bought it a long time ago, more than so many months ago. Somehow there was an incident at the barracks. He was locked up in the cell, and somehow, whether he committed suicide or whatever happened, he lost his life. Investigation started. So many security agencies were coming in. They got to find out that he's a drug addict. Where does he source his drugs from? The name of that pharmacy came in. So from Abuja, they sent in a team, military, NDLE, and everybody that needs to be there. They came to Sokoto. I went to this pharmacy. This person is dead. And it's been a very long time that he bought that item from that place. They came to the pharmacy. Where is the pharmacist? The pharmacist was not there. What's his whole name? They gave her name. They placed a call and asked the pharmacist to come. The thing became a full-blown case. Why did it become a full-blown case? Because the pharmacist was not doing what he or she was supposed to do. Because it means this person was coming to the shop and he was getting this kind of thing without any hindrance. Meaning, even the sales boys and the sales girls are free to sell it. And when they sell it, they will go to the poison book and they will write the quantity that they have sold and the date. Most of you have seen the poison book. You know that it has the name of the dispenser, the name of the patient, the quantity, the date, the address of the patient. Everything is there that can make you to be able to track who accessed this medication and who gave it. Right? At the end of the day, within the poison book, there were different items. So it's very easy for you to know that it's not only the pharmacist that is dispensing it, because a pharmacist registers a place only for 1 year. So you expect that it is the pharmacist that is entering, is the same person until the next year if they change another pharmacist. Or perhaps maybe if there's a local pharmacist who also have the license to dispense. The case became very, very serious. The only thing that saved that pharmacist was that one of the people that sent to investigate from the military side from Abuja happened to be that person's cousin. And without him or her even knowing that chief investigator that came was broadly related to her or to him. He was one of the aunties. Somehow, then the person got to find out the pharmacist is investigating is a blood relation. And that was how the case. So, but you can imagine some of the risk involved. We are putting a lot of ourselves under a lot of risk. Whom are lying unnecessarily. Why did I say unnecessarily? The amount of money you collect. I swear to God, I will not do kafara if I ask one of you that registered last year. If I ask him the money you have been paid, please, what did you do with it? The person may not even remember how he spent, how she spent the money. You just put the money in lump sum and give you, and that's the end of it. 2-3 days after you have finished it, you don't even know what you spent. But you have found your life, your professional life, in the shop. And for the next 1 year, whatever happens there, you are liable. So, ladies and gentlemen, as professionals, we need to do the needful. We know that the country is not, but I want to believe that if we start doing the right things, we can still effect some change.
Poor prognosis. Then, solutions. What are the solutions of these challenges? That is better forecasting, regular audits. You understand? So, when you are estimating what you need, you understand, it has to be evidence-based. You can't just predict. Do you understand? If you want to, that's why keeping records is very important. Most of these community pharmacies, they don't keep records because they collect money. You understand? Most of us have the maybe wrong perception. That is only these free care programs that we need to keep records. Do you understand? Something that I sell out and collect money, I don't need to keep records. Do you understand? For the community pharmacy, those that are using softwares, you understand, to issue out commodities, it's easy for them to track the record. But that record cannot be complete because usually these places don't capture the name of the patient. Do you understand? They only typed the drugs that you buy and the quantity. Do you understand? They will just print out the receipt and give you. But some of these softwares, they are provision for the patient name. Sometimes even the addresses. We don't take our time to complete that one. Do you understand? So that record is very important. As we said, we talk too much about control, and you are the one in control. Do you understand? So, when there is a national quantification for these control drugs in the country, even the private sector is also involved. Do you understand? Because, as we said, this procurement from outside the country has to be evidence-based. Do you understand? This is the quantity of, this is the number of ampoules of, do you understand? And it is in the states, it is the requirement of different health facilities and different community pharmacies. Do you understand? So this is how it is. You can't just predict and say that I need so quantity without any evidence. Do you understand? So that is the records. The record is very important. Those pharmacies that don't use softwares to dispense, you can't see any book there that they record what they did for that. Do you understand? Their concern is how much they made for that day, not how many patients I attended. Do you understand? It's very important. Very important. So, any question?
That is coming for control drugs. I was one of the victims when I was recruited as a local pharmacist for 6 months in Zamfara State. The issue is that there is one captain that used to come to the pharmacy. What he is after is just that the control drug. Sokoto, DFF, the pentazocine. You come with prescription, then you write that here like 30 packets. Pentazocine 2 tocodomol 2 packets. It has a collaboration with the director of the pharmacy there. What he used to do is that the director will assign the pharmacist to fill the control book. But when it comes to issue of the drug, he's the one responsible for issuing the drug. As I came in, I realized that the prices, that was determining that this guy is.
Another trend that is due to the inability to forecasting. You don't manage in the place. You are not able to focus when you don't know what is almost to finish. Because you cannot procure without.
So you have not done a good quantification of what you need. That's good
forecasting.
You are not able to get it from where you go to get it. That's another one. Like the color, with the clarity of the suspension, with the syrup or whatever it is, you can make observation and say, this thing has spoiled, and so it's wasted. So some of the things we mentioned are also solutions to this issue of wastage. For immunization, pour this. It's just a question of time. They will fizzle out. If somebody knows that if he comes to the facility, he gets what he wants, that is a big opportunity for the health facility to offer other services. You understand? But whenever somebody wants to complain about facility, the first thing they will mention is bargaining. Does that have bargaining or bargaining? And we are the ones. If we can make our DRF to work, I'm telling you, we are the ones that will reap the benefits of that effort. So let's just have a thing. Whatever you see happening in that pharmacy department, you are responsible. And if it works, you be the primary person that will benefit from it. Apart from the fact that you are the one that is in heaven, for making the drug available to save lives. So please, let's just have a think over that. It will not just disappear in Lagos and appear in Sokoto. Somebody has to what? Somebody has to issue it out, somebody has to pick it, somebody has to transport it, and then when he brings it here, somebody has to what? Receive it. And when you receive it, it also needs to move from that person that received it to where the patient will be consuming. So it's a whole lot of back and forth, with so many what? With so many stakeholders. It's not just a single person. Starting from the person that placed the order to the person that dispenses it to the patient, and all the other things that are in between. So looking at all these processes and all these people that gets involved needs to be what? They needs to be managed so that what? The commodity will be made available to the customer or to the patient when he or she needs it. So looking at all this together, if you want to summarize and give a meaning to supply chain management, so all these things are things that we have to look at. What? The planning, the local controlling, and informing and monitoring action within and between supply chain. When I say within and between, it's all those links that we have mentioned. Right from where we are sourcing the medicine to where the patient will use it. So that what? Integrated supply process. When you say integrated supply process, what are you talking about? It deals with activities such as transportation, warehousing, inventory control, and what? Order processing. All these things that have been mentioned here, they are about moving the item. You can only transport something when you are moving it from one place to the other. And you can only you warehouse it because you're storing it to also move it elsewhere. You do inventory control also to avoid what? Those problems that we have mentioned before. Expiry, wastage, and making sure that you have an effective and efficient movement of goods, collaborating very well with the rest of your colleagues in the facility. Perhaps the CMD may decide to go and buy commodities without any knowledge. He can plan to buy commodities for some intervention without what? Without the knowledge of the pharmacist. Are we together? You know, we mentioned logistics, right? We say it's the movement of the what? The goods. The effective and efficient movement and storage of goods along the chain. Now, it's a cycle. Because at the top there, you have what we call serving customers. Why do we move commodities? Is at the end of the day to serve a client. Right? Now, because of serving the client, we need to do what we call what? Product selection. We need to select what product we need. If we don't select the products that are needed, what happens? We'll have wastage. We mentioned that. The customer will not be satisfied because he wouldn't get what he needs. At the right time, good. At the right cost. Right customer. That's the 7th one that came in. So these things have just been mentioned, not in the order. But if it's in order, you talk about what? The right product, the right quantity, or right condition, to the right place, at the right time, at the right cost, to the right patient. Are we together? That is the whole purpose of logistics. Sometimes we compare logistics to what we do in our various houses. In our kitchen, perhaps, that's the one that we used to use as an analogy. Because if you go to a restaurant to eat, 500 consumed in December, for example. If you look at this 3 months backwards, which of the months do you need to take to average that you think will be appropriate? Exactly.